Good morning, good afternoon, everybody. Welcome to today's online presentation, Tools and Resources to Support Optimal Employment of Internationally Educated Healthcare Professionals. Before we begin this presentation today, we would like to take a moment to begin with an acknowledgement that N4 is hosted at CHIO, which is located in Ottawa, Ontario. Ottawa is built on unceded Algonquin and Anishinaabe territory, and the peoples of the Algonquin and Anishinaabe Nation have lived on this territory for millennia, and we honor them in this land. Their culture and presence have nurtured and continue to nurture this land. We also honor all First Nations, Inuit, and Métis peoples and their valuable past and present contributions as well. My name is Andrew Tomeyer. I'm N4's Education Coordinator. I will be hosting and moderating today's presentation today. As well, we have my co-host and colleague, Colleen Drake, the Engagement Coordinator for N4, who will be monitoring the Q&A box today. I'm pleased to introduce you to our presenters, all part of our N4 team as well. We have Christine Kouri, the Director of N4, Sahar Zohni, our Manager of Operations, Planning and Performance, Michelle Quinlan, Team Lead of Knowledge Generation and Mobilization, and Catherine Penney, our Quality Improvement Specialist. Welcome everybody today. Now, today's session is being recorded and will be uploaded to our N4 platform. We will share this with you as soon as it becomes available. Should there be any technical issues during this presentation, we will inform you with details for an alternate makeup session. And finally, before we begin today's event, a little bit of housekeeping. I would like to take a moment just to introduce you to the Q&A feature that can help enhance this participation experience. We'll be having our Q&A portion at the end of the session, near the end of the session, and we invite you to write your questions in the Q&A window. We know that sometimes many of you might have very similar questions or be interested in a particular response, so you do have the option to upvote questions as well. Please upvote questions you're interested in hearing the answer to, and we will prioritize the questions. And with that said, I'd like to pass it over to our N4 team to provide you with today's presentation. Take it away.
Great, thanks, Andrew, and welcome everyone to this event. We're really proud of the work we've done to develop this resource hub and excited about getting the word out there to learn more about it. Juste un mot pour ceux qui sont francophones, qu'on va avoir un autre événement de lancement le 27 mars en français. On va voir le lien dans le chat si vous voulez vous inscrire pour la session en français, mais merci d'être venu. So just a reminder about N4, for those of you who might not be familiar with N4, our mission really is to create equity for newcomers within the health and social services landscape. We do that by providing our platform, and our tagline is Connect, Learn, and Collaborate around system navigation. And so this one effort is around creating equity for those who provide services within healthcare and are also newcomers. We have many more resources as well for those who are providing service to newcomers who are either patients or clients in their services. I'll go to the next slide, Andrew. So we do have a membership for those who have not become members. I strongly encourage you to do so. Many of our tools, including the Resource Hub, are open access, but some are interactive, and therefore we ask for membership as well. Membership lets you find each other and find other people across Canada who similarly have an interest and passion for creating equity for newcomers. So you'll see that we do have coast-to-coast representation. Membership is free. That's one of our tenets at N4 is we don't want any barriers to participation, so membership is free as well. I'll go to the next slide. So to provide context on why did we do this work and why do we need this resource hub, we know that healthcare continues to have huge gaps. There's continues to be a health human resource crisis that was on the horizon, but really got fast-tracked during the pandemic. And so we see that we've got this huge gap, particularly in nursing and family physicians amongst Canadians. And so one of the ways that's been strongly acknowledged and people are working towards is leveraging those who are internationally trained and could help us out with this. They want to be in Canada, but they're just experiencing barriers. And I'll go to the next slide. So this is a bit of a snapshot showing that green line on the top is healthcare. It is the number one sector with vacancies in Canada compared to other sectors. It's not moving forward. So despite that, and immigration has strongly heard, we need nurses, we need physicians. They are highly ranked in terms of and prioritized for immigration. They want to come to Canada. We are amongst the top destinations in the world for immigration because we're such a welcoming society. But that said, our track record in terms of getting nurses and physicians to actually work in their profession is pretty dismal. You can see here that less than half actually end up working in their profession. And so that's what we at N4 have been really strongly working on, change those statistics and get more folks to the bedside. I'll go to the next slide. So I'll hand it over to Michelle Quinlan, who is going to talk about how did we do this work, just so you know it is evidence-based, and then hand it over to the team to review the resource hub. Over to you, Michelle.
Thanks so much, Christine. So before we dive into the content of the IEHP Resource Hub that Christine mentioned, we're very proud to be launching today. We'd really like to take a moment just to set the scene in terms of how some of these IEHP products were created. So we'll see on the slide here, here at N4, we have a proven community of practice model, which was put into implementation in 2020. So drawing on the broad reach of our network and beyond, thinking about the map, our community of practice membership is multi-sectoral and national in reach. It's governed by a multi-sectoral COP steering committee, and that community of practice has a goal to address the root causes of inequities for newcomers in assessing and experiencing health and social services, and really bring subject matter experts together to these time-limited tables to produce, as you see on the screen, evidence-based, outcome-driven, and impact-focused products. Here at N4, we provide support to the COP, and we facilitate bringing sectors together to collaborate in real time. We facilitate the creation of multi-sectoral working group members with a commitment not just to strategic speak, but really commitment to concrete outcomes. Such as the development of practice recommendations and position papers that we've written in the past. Notably, our team recognizes that providers are busy, and at N4 we do commit to doing the heavy lifting in terms of project management support, admin support, research support, comm support, as well as knowledge mobilization efforts. And so on the next slide is how that sort of showcases what it is we did with that COP model and create a structure for the IEHP work that we're doing. N4 created 2 6-month working groups, one aimed for IENs and one aimed for ITPs, as you see on the screen. The working groups were formed to create a set of actionable recommendations based on a common understanding of, first of all, what's the current state? Number 2, what are the key barriers and facilitators? And number 3, what is the future desired state? And we focused on highlighting best and promising practices to address the key barriers to optimal employment. In addition, as showcased in the oval boxes on the screen, N4 formed consulting groups consisting of Canadian ITNs and ITPs who were currently seeking licensure and really served to validate the findings and recommendations of the working groups. This separate and confidential space allowed them to share their lived experience amongst peers. We are proud of this commitment to lived experience, hearing frustrations among IEHPs that they had not been involved in system-level recommendations. Lastly, as showcased in the red box, N4 connected with employers across sectors and provinces through the Employer Consultation Project to understand the barriers that employers experience as they aim to attract and retain IEHPs, and of course the barriers IEHPs themselves experience in the process. This was not a working group for this work, instead it was a network of employers that were created. And so the next slide showcases that following engagement with over 100 organizations, N4 began recruiting to the Community of Practice working groups. We prioritized including an array of voices in the working groups, including the voice of lived experience, faculties, governments, regulators, and associations, to name a few. The IEN working group was co-chaired by Dr. Edward Cruz, RN at the University of Windsor, and Joyce Chris Jansen, RN at the Association of Regulated Nurses of Manitoba. And the ITP working group was co-chaired by Deirdre Lake with AMGA and Joan Atlin, the Director of Research and Policy at West. The next slide shows an overview of reports that we were proud to release last spring. A missing part of me, which was a pan-Canadian report on the licensure of internationally educated professionals. This was a qualitative analysis of 70+ site visits with IHPs with lived experience and organizations who support them. Each time we met with an individual or organization, we took rich notes, which we validated with those present at the meeting. The notes were then uploaded into NVivo and coded by theme, and this analysis is written up in the report form. Really, this work provided a solid thematic overview to N4's work in this area, with a focus on documenting the barriers and facilitators to practice in Canada. The second two reports are twin reports, which present recommendations to removing or mitigating the barriers to practice, which were expressed in a missing part of me. These reports were developed in collaboration with our COP working groups and supported, as mentioned, by lived experience. Each recommendation comes with an explanation of best practices, needs, and key partners who would help us bring those recommendations into practice. If you haven't had a chance to read the two reports, part of the solution, recommendations for welcoming ITPs into Canada's healthcare sector and welcoming IENs into Canadian healthcare sector, recommendations for change, please take note that we will be sure to send these reports to today's attendees. And the next slide provides an overview of the recommendations that were summarized in the reports. And each bullet point is explained in detail in each of the reports and broken down into a series of sub-recommendations which are specific and actionable. As you can see, there are separate recommendations for IENs and ITPs, reflecting the differences, of course, in licensure and the regulation of those professions. I'd like to take a moment to draw your attention to the gray box on the screen, which were two more key recommendations which applied all IHPs. There was a need felt by lived experience and working group committees to highlight clear, up-to-date, accurate information, because misinformation and misunderstandings were so common in this space, and the pathways to licensure were so complex. As we'll explain in today's webinar, the red highlighted recommendation was one that we felt we could take on here at N4. And so the next slide will show how it is that the recommendation for a single source of up-to-date and accurate information regarding the pathway to optimal employment was actioned by our team, of course, through the development of the IHP Resource Hub. So we'll take some time today to dive deeper into the sections of the Resource Hub. We really did hear, as I mentioned, from IENs and ITPs and those who support them, that they need this one-stop shop to go to for up-to-date information. It is our goal that this information will help direct IENs and ITPs towards optimal careers as they become integrated into the labor market. The Hub is available in both official languages and includes pathways to licensure, navigation services, provincial initiatives, bridging programs, settlement services, non-clinical supports, employer information, and the employer toolkit and checklist. The next slide showcases how this very proud milestone in terms of the work here at N4. We're very proud to share that after an investment of time and energy of the COP working group members, the N4 team, and informed by lived experience, the ITP and IEN pathways were published in December and early January. This is the first of its kind in Canada. 1 IEN visual pathway and 5 ITP visual pathways to licensure infographics are available, with direct hyperlinks to IHP relevant partner information pages, with fluid information at the embedded hyperlinks. Shortly after this webinar, we will provide you with a link to a teaser video for each of the pathways to help share these specific products with your networks. Today, our aim is to socialize you with these pathways. It is important to note that shortly N4 hopes to host information sessions for IHPs and organizations who support IHPs to help orient you to the pathways. Stay connected with us to learn more about those dates and plans. I'll now pass it to my colleague Sahar to provide a deeper dive and overview into the pathways themselves.
Thanks, Michelle. And I echo what you said. We're really very proud of having the pathways now available. We have heard a lot from, from the working groups, how important, and from our internationally trained physicians and internationally educated nurses, how important these pathways would be for them, given that, they usually it's pre-arrival, it really is dependent on how much information they can gather from the different websites and also how updated these websites are. Sometimes it's really all related to word of mouth from ones who might have gone through the process earlier than them. So I mean, like, it's a lot of confusion for them. So that's why having those pathways again, was one of our dreams, I must say. And thanks to the collaborative work and the involvement of the Pan-Canadian stakeholders that worked with us closely, including our regulatory bodies, professional associations, bridging programs, and organizations who were employing internationally trained physicians, and also the internationally trained physicians themselves. We had really the pleasure of working closely with them through the consulting groups to get their insights on the pathways as we developed them. As we were continuing the work along for more than 6 months, we realized that there are really very distinct pathways for internationally trained physicians and for them to become licensed in Canada. And these pathways were very complex, had very different steps that came in different orders for the different pathways. So we really decided that we cannot have a single pathway or a national one. We really need to, provide 5 distinct pathways, and that would reflect the different ways for them to get licensed in Canada. And as you can see on the screen, they are now available, those pathways. They're available as infographics that can be downloaded. And since we actually uploaded them on the website as part of the IHPS Resource Hub, we are very proud to have had hundreds of downloads and interactions with the pathways. So again, I encourage you to download them, and we made it very one of our very important pieces of developing those is really adding those links to the relevant organizations. So the pathway has links to the relevant organizations that would take the internationally trained physician to the right website. And by this, we're making sure that the pathways, they stay accurate, and they also are current, as changes are implemented by the different relevant organizations. The pathways depend on the country of training for the internationally trained physician, their specialty, and also given that we have different provinces with different regulations for sure. So which province they decide to live in and work into would really impact which pathway, and the steps in the pathway for them. So let's go through maybe one pathway at a time, just very high level. So our first pathway relates to the, maybe I'll go to the next one, next slide. It relates to the approved jurisdiction route for specialists, and this one this pathway refers to countries or regions whose medical education and their training programs are recognized by the Royal College, and they have 7 countries listed there. And for those internationally trained physicians coming from those approved jurisdictions, the pathway to license will be really smoother in a sense, and we lay out all the steps as I mentioned. The next one is our practice eligibility route. So for many of the internationally trained physicians who have extensive clinical experience and yet they might not be their medical schools and their training programs are not on that list of approved jurisdictions, they might not be able to get licensed through that path. So the PER would allow them really to get this formal certification recognized by the Canadian Medical Regulatory Authorities. So they apply and they get that assessment completed, and then they proceed with the licensing process. The next one is our residency pathway. And this one includes participation in a medical residency program in Canada. And it allows the internationally trained physicians to gain the Canadian clinical experience and further training. So they would apply for a residency program through CORMS, which is the Canadian Resident Matching Service. And if they do get matched, they complete a residency program, which ranges between 3 to 5 years, depending on the specialty that they were matched to. The next pathway is the Practice Ready Assessment pathway. And this is an accelerated pathway to licensure for those who have already completed the residency outside of Canada, and they have been practicing independently abroad. So they would apply for a participation in a 12-week clinical workplace-based assessment, and they will participate under supervision in this program. And then they will be legitimate to move forward and work, towards their independent practice in Canada. Most of the provinces now do have a PRA program, and the ones who don't are moving forward with steps to getting such a program. The last one is our alternative pathways, and this pathway is really for internationally trained physicians who have a recognized training and a certification from abroad in family medicine or general practice from 4 countries that are listed by the College of Physicians, College of Family Physicians of Canada, and they apply directly to the College of Family Physicians of Canada to get the assessment and move forward with getting their license. So those 5 pathways, as I mentioned, relating to the ITP are now available on our website. So kindly just within yourself download them, or within your network, if you can encourage people to check them and download them. Our hope is that information would be available pre-arrival to inform decisions of our internationally trained physicians as they are coming to Canada, and also to help them if there are steps to be taken before they arrive in Canada. This would really help them to maintain their currency of practice as they come to Canada and they start their journey to get their license. Next is our internationally educated nurses pathway. So as you can see on the screen, we have worked on a national view for one single internationally educated nursing pathway. And for that, we have tried really to present the information available for us in the clearest way possible. We've done very similar to the internationally trained physicians. We were very keen on adding the links to all relevant organizations that are legitimate, and they by clicking on these links, the nurses can contact those organizations, visit their websites. And we really added those links because we are aware that there are lots of, organizations out there, and this might be very confusing for our nurses. Very similar to the internationally trained physicians, many of the steps can be done really pre-arrival as they're thinking of migrating to Canada, and for them to really maintain their currency of practice once they arrive in Canada. The steps do include credential assessment, registration with the provincial regulators. There might be a need for them to complete additional steps like bridging programs. And all these are listed, again, the bridging programs are listed on our website, and I know we'll go through them and where to find them through the hub. Then they will be legitimate to sit for the NCLEX exam. And as I mentioned, all the links are there. And we also have we're hoping to be able to, now that we have uploaded all our pathways, we're hoping to, moving forward, to provide host information sessions for our IHPS themselves and IHPS supporting organizations to really help them and orient them to the different pathways. I'll now hand over to Catherine to tell you more about the other resources on the hub. Thank you.
Thank you very much, Sahar. So I'm going to be speaking to other resources that are featured inside of N4's IHP Resource Hub. The first is navigation services. This is something that came up quite frequently in our engagement with IHPs with lived experience, that finding reliable information is often difficult due to the saturation of the current environment. It's very difficult to decipher where, who, and what trusted resources are. And so N4 was able to address this issue by creating a page in this hub that specifically highlights navigation services that are funded by provinces. And so you can see from the slide that we have professional specific services, nursing, physicians, and other. And within this, you're able to see what each province has as it relates to providing navigation services. Luckily, since this work has began and since N4 has been involved in this work, many provinces have created their own robust navigation services, and they all are uniquely structured. So really encourage you to look through this site if you're in a province to see exactly what resources are available to you. We also know that every province are creating really innovative programs and initiatives to combat this HHR crisis and to improve the pathway for IHPs. And so what we have in this featured tab in the Resource Hub is a list of vetted organizations and initiatives that newcomers and IHPs can look at and know that they're finding really reliable sources. And so it's a repository of initiatives, and it really aims to improve and to lower the barriers for licensure for IANs and ITPs. Just as an example of what you can find under nurses and under Ontario, you'll be able to see, for example, IANs in Ontario, they have created a program called the Supervised Practice Experience Partnership, SPEP, and it was launched in January 2022, and it allows eligible IAN participants to complete a minimal practice experience in order to receive licensure. And they've successfully licensed over 3,000 nurses through this pathway. And as I said, it is a very innovative pathway and a really great initiative. And those are just a few of the examples of what we would like to highlight in this section. And we know that as this space continues to grow, that there'll be more initiatives to add. And so we really encourage our members or anyone who is aware of information to please share with us. It's going to be continuing to expand, which we're excited about. When it relates to bridging programs, we also know that this is really important. We understand that bridging programs are essential for IHPs to assist in addressing educational or practice gaps. We have a list here of nursing bridging programs that have been validated by regulators. And this is really key because we also, again, with finding reliable information, know that there are a lot of bridging programs that are really great, but perhaps don't offer IHPs or IN specifically what is needed to become licensed. It may help in other factors, but not that licensure. And so it's really key for us to create that one place where you know you're finding bridging programs that help you in becoming licensed and that are vetted by regulators. We also know that there are no current bridging programs for physicians, and this is one of our recommendations within the ITP recommendation report that Michelle talked about earlier. It is one of our recommendations to create bridging programs for physicians. And again, when more information is provided to us on bridging programs, we are excited to update this to reflect the current state. As it relates to settlement services, we know and fully appreciate that IHPs arrive to Canada to live, not just to work. And so it's really essential to support that and link whoever is needing these services to settlement areas to help and support their families and also themselves as they settle into their new communities. And so we included in this feature IRCC, Immigration, Refugees, and Citizenship Canada. They provide funding to more than 500 settlement service provider organizations across Canada. And these services include pre- and post-arrival settlement support tailored to internationally educated health professionals. That includes employment-related services, language services, housing, etc. And we also have more that are coming that are province-specific. So if you're arriving to a province and you want to know who is in that settlement sphere that could help you, that'll be available on this page within our IHP Resource Hub. We also know that non-clinical support is really important for IHPs, that training as it relates to mentorship, peer-to-peer support, as well as learning those soft skills have been really important and a really key factor in success for IHPs. And so in this platform, we're highlighting those organizations that provide that non-clinical support. For example, we have AIMGA out of Alberta, who provides support for IHPs. Within Ontario, we know of CARE that provides one-on-one case management and language and communication skills for IENs. And then N4 has an SPU program with St. Paul's University that helps with that, more the soft skills that many IHPs look forward to obtaining when they come to Canada, learning about the Canadian context and all of that stuff that is outside of the clinical sphere. We hope that that list continues to grow. As it relates to employers, we know that having employer information is really critical. And so we have a tab as it relates to employer information, a list of websites with job openings within the healthcare sector that IHPs can find. It actually goes beyond nursing and physicians and also speaks to professions and information for dentists and pharmacists. But we also created support for employers, and that's what this slide is referring to. We produced an array of tools to support the recruitment and retention of IHPs into Canadian healthcare organizations. We know that licensure is not the final step. We know that it is employment that is that final step. And we know it's really important to all IHPs that they are employed in a welcoming environment. And so what you'll find in this resource hub are tools to assist employers in creating that welcoming environment. And so we have a toolkit and a checklist. This checklist is exactly that. It just supports employers, things they can do to prepare for IHPs arriving into your organizations before they even arrive, things they can do to onboard, and of course, key things that are needed to help retain. We're able to take key themes out of this checklist and create a webinar series, which is also available in the hub. And I just want to highlight that quote that we see in the gray box that just highlights that how useful employers are finding this checklist and really seeing that if they're missing something, it's an opportunity to work towards. And it's available in both French and English. And I think with that, I'll pass it to Andrew to continue our presentation. Thank you.
Thank you. So before we move into our Q&A portion of this presentation, I would just like to also talk about other sources of knowledge and information available to you on the newterminavigation.ca website. This information will be made available after today's webinar as well, with links to sign up and such. So along with that, additionally, the IHP Hub provides links to various other elements that can help IHPs across Canada, including that of our RSS news feed with links to various news and events and items directly related to IHPs, both in English and French, happening across the country. We also have our IHP newsletter that's available to those that would like more information on what is happening as well. Along with that, our N4 SPU IHP online program, which I will touch on in just a couple minutes, and our conversation cafe for those that would like to participate and discuss with other IHPs across the country to provide more information, provide more resources to one another, provide more discussion on elements related to being an IHP and the context of following your career pathway. Along with that, we also have our resource library and our e-learning library as well. With that, our RSS feed has many articles available to you if you'd like to check it out on our website. Along with that, our monthly newsletter with thousands of subscribers more being added every day, receiving news on what N4 is up to, what our partners are up to, upcoming webinars, and many other resources available. As well, we have our IHP-specific newsletter for those that are interested in the IHP-specific information out there. Along with that, as mentioned, our N4 SPU IHP online program is happening currently for our 6th cohort at St. Paul University. The program, Fostering Canadian Integration for Internationally Educated Healthcare Professionals from Learning to Action, is free. It is funded through our work with IRCC. You receive a certificate of attendance. There are limited spots available, and it is 100% online, so those across Canada can participate in this program. As we are currently having the 6th cohort underway, our next cohorts will be happening in fall. So keep an eye out on our website. We will be opening up pre-registration this summer for both our French and English cohorts happening next fall. And with that, we'd also have many participants that have been part of this program that have given quite a positive response to participating in this. And with that, they are from across the country, across the globe, with respect to where they are all coming from. Hundreds of different individuals from across the globe have stated that this is a very good program to help them provide the context they need in order to help successfully pursue their career pathway. And then finally, we also have our resources and e-learning libraries available to you as a member of N4. It is many different types of trusted content, including academic journals, including various articles as well. We have thousands available to you in both French and English, along with our e-learning materials available both from our past webinars and future webinars available to you too, both in French and English as well. And we've received hundreds of thousands, 110,000 views. That's continuously growing every day. So excellent response to the resources that are available to you as a participant and member of N4. And with that said, we're going to open it up for the questions and answers section of our presentation today. And speakers, please turn on your cameras, unmute yourselves as well. And with that, so many questions have come in so far. And for those here, our first question is, can we have individualized consultation to have more orientation on where we are and available choices based on our particular case? So whether this is related to, are there resources relevant to receiving one-on-one orientation?
Yeah, I can take that. Thanks, Andrew. And please, if you have more questions, feel free to add. So we at N4 aren't a direct service. So I'm not sure if this person is a professional who's helping an IHP or an IHP themselves. If you're an internationally educated health professional, there are those navigational supports. I would strongly encourage you, go in the hub, go to navigational services, and you'll see by province and by profession who can help you out. If you're still confused, send us an email. We're happy to try and direct you to the right resource. But definitely consult those resources. And I saw Arena, thanks for attending, Arena. she provides support for internationally educated health physicians in Ontario. So there's one resource who's already stepped up and say, we have some services, but depending again, what profession are you in what province, look on the hub and we'll help you out with that.
And to add to that, Arena had mentioned that the Access Center for IHPs at Ontario Health has this service for IMGs. They can look into your particular situation and advise on options available for you. However, they do not offer one-on-one appointments, but we consult via emails and during weekly Q&A sessions. So keep an eye out on the Ontario Health as well. Thank you for that response as well, Arena. And thank you, Christine. Our next question is, we did mention a focus towards our IENs and ITPs. One of the questions that came forward is there any internationally trained dietitians, any options available for likely other types of IHPs as well, your dentists, your optometrists, and many other types of healthcare professionals too?
Yeah. So I think some of the resources really touch on all IEHPs. They give hints around, certain things you can do. The pathways are so far we've been funded to only look at nurses and physicians, and that relates to those being the largest gaps in terms of the number. But dietitians have worked with them. I'm a nurse by background. Have worked with them. They are tremendous, especially for those who are diabetic or have a genetic condition. They're so key to their health. So I appreciate your putting up the hand around dietitians. So I would say have a look. If you think there's a lack, please reach out to us again, because this offers us the opportunity to look at funders who will fund us to do work in those fields. So far, we've only been funded to look at nurses and physicians. The employer toolkit would address, no matter what profession, it's really those foundational elements that employers should have in place for all their internationally educated health professionals to make them feel first ethically recruit, help them integrate, and then help retain them. So hopefully there's some resources in there, but feel free to send us again an email. Happy to chat.
Thank you for that, Christine. And to add, Irina has also mentioned that they do also at Ontario Health have an access center at their access center for IHPs, they have an advisor as well who can work with internationally trained dietitians as well.
Yeah, exactly. Many of those navigational supports do all internationally health professionals. So have a look-see. Yeah.
Thank you. Our next question is, could you explain if a license for an RN is transferable between provinces? If so, what is the designated process or who to reach out to?
So they are transferable. That's whether you're an internationally educated nurse or a nurse like I was, trained within Canada. There is what they call the free trade within, it sounds odd, but that within Canada, they have to accept your licensure between provinces, and it's been challenged in court and proven, yes, they have to accept your license. So once you have a Canadian license, you go to the college, in this case, nurses, you go to the College of Nurses in the province where you want to apply, and there's an application process. As a Canadian nurse, you would just follow that route and we'll guide you through, but yes, they will accept it between provinces.
Thank you. Thank you. One of our next questions is from Leah out in Saskatchewan. As a program coordinator for the IMG support program, is there a way to connect to share information in the IHP hub?
Yeah. Maybe I'll look at Sahar.
Yeah. So on the hub itself, we have a tab where you can, if you have any resources, you can easily add those resources. But again, there is also a contact us if you need further, contact with us, and it can be via email or response via email, but we're more than happy to meet if needed for sure. So yeah, please, if you have a resource, add it. And I'm just, thank you for raising this, but also for everybody. If you have any resources, we're always looking for updates from the provinces and also from the multiple sectors that we're working with. And again, if not, just contact us if you feel that we need to, to chat or you need further information. We'll be more than happy to meet. Thank you.
Thank you. One question that we do have is from a nurse from the Philippines with respect to gaining more knowledge on the work experience part. She is a community nurse, She would like to ask, is the community nursing experience qualified to support as work experience, and if they will proceed with the program, and what options are available?
Sure, I totally understand, but I'll answer according to what I understood. So this is somebody who has not yet come to Canada. I would strongly encourage you to look at the pathway, because many provinces now, if you have an active, valid license from the Philippines, they accept that as being equivalent to the Canadian license, and they're going to fast track you in those provinces to accept you as your licensure. And then there is a step around our exam, which we do in Canada called, and US also do it, is called the NCLEX exam. So please look at the pathway, and I would suggest you look at which provinces, if you haven't selected your province, if you're open to any province, look at those who accept the Philippines licensure. It does not matter where your experience is. She mentioned community versus a hospital. What they look at is valid licensure, and that you've been practicing for a certain amount of hours within the past 3 years.
Thank you. Thanks for clarifying that. One question that we do have is from Shan. Hello, I'm an employment counselor at CICS in Toronto. Currently, we're running a pilot program funded by the government to help IENs who wish to improve their English level so that they can work as a personal support worker while working towards their registration. Who should I reach out to share our information? And many thanks.
Sounds like a great addition to our resource hub. Hey, Sahar?
Yeah. So on the website, if you can add that to the website. And again, I think I see Colleen adding the link to the hub. And again, we have that tab where you can add or share with us any resources, information about the program. So all you need would be adding the link to the website, to your website. And again, feel free to send us an email via contact us, and we will definitely respond to you, and we'll be more than happy to add that to the website for sure.
Thank you. And to add also, noting with respect to the one-on-one piece that we discussed earlier, we have a response here from Marianella Gonzalez at CT for international health professionals. They do provide supports for international health professionals in Ontario with regards to the one-on-one support. So with respect to that, we very much can provide you their information as well. We're very good and connected with them. And just to add to that previous question from before. So thank you for that, Marianella. One of the other questions that we have is, as a PRA applicant, what province do you think, in your experience, is most ITP friendly, is most friendliest with ITPs?
I don't think it's friendless, it's opportunity, right? Like they have set number of, you know what I mean? We know, for example, that BC now they are tripling their PRA program, right? So with that tripling, there are more spots, I would say, for example, right? But I mean, like, I don't think there is a more friendly, less friendly. I would say it's more, you know, how many candidates and how many you know, supervisors are available, right? And supervision opportunities are there, right? So I would say, yeah, it's by the, you know, the province's capacity, right, to how many they can really provide that opportunity to. I don't know if you
Sahar, I do
looking at the
know
panelists.
some. Yeah, I do believe there's limited, like the PRAs that they're probably referring to are around family medicine, but is there one province that does special PRAs?
Are they asking about the specialists?
And I'm just wondering.
Alberta and Manitoba, they provide specialists. Yeah. So if you're looking for a family medicine, it will be the other, you know, most of them. But if you're looking for a specialist, it will be Alberta and Manitoba.
And to add to also, Irina from Ontario Health also mentioned it also depends on your postgraduate training.
Mm-hmm.
Looking at also the questions, is this webinar going to be available in French?
Oui, le 27 mars, on va répéter La session, ça va être seulement moi, mais on va répéter. On a quelqu'un qui va nous rejoindre, qui est une infirmière qui a été éduquée à l'extérieur, qui va m'accompagner aussi. Mais le 27 mars, oui, donc la registration, c'est dans le chat.
Thank you. How can I get more help to learn more about the IN or ITP pathways?
I think start by visiting our hub. So I recommend visiting our hub and looking at the different pathways and then looking at the navigation support. So I think navigation support, as we were talking, the ones maybe the ones that are a group focused ones would make sense, but also individual one-on-one support. Settlement organization provide different types of supports too. And then I would encourage you to reach out directly, right? If you're working with a settlement counselor, employer counselor, and yeah, I think that's the way to start.
Thank you, Sahar. We do have one other question related to, so we had mentioned about the those from the Philippines and the licensure process for nurses. Does that also apply to physicians?
No. No, so the approved jurisdiction countries, they do not include the Philippines. So US, UK, Ireland, Switzerland, South Africa, Australia, New Zealand, and Hong Kong. They are the approved jurisdiction ones. So unfortunately, Philippines is not. But again, you can go through the PER. So if you are a specialist, you can go through the PER route, which would be if you have the experience, right, and clinical experience, and your program and your country are not listed on that one of those 7 countries, you can still apply right directly for assessment, and then you can go the PER route.
Thank you, Sahar. And to add to it as well, thank you, Arena, for your input as well in the questions and answers. As Sahar said, it's mostly related to your specialty and your postgraduate training.
Yeah.
Let me see. What else do we got? We have so many questions coming in today. It's been an excellent session. This one's coming from Cheryl. I was wondering if there's financial sources to help with the ITP pathway for licensing. I am a career and training counselor with a chief who provide a source of financial aid with a FCR microloan to help pay for training. Is there someone I can connect with to share this info?
I believe we are connecting. We got a request from a chief to add their information to the hub, and I believe Colleen is going to be reaching out to make sure that we first have that initial site visit to learn more about the organization, what types of financial support they provide to IHPS, and then we will be adding that information.
Yeah. As you see, as intimated in Sahar's response, we really vet the information before it goes on the hub. There are some folk who know this is a cash grab they can do and it doesn't lead to licensure. So we just want to make sure everything aligns well before we put it on the resource hub if it's not something we're familiar with. But we just want to be a very trusted source of information for folks who access our hub. So we look forward to connecting though with Chief. Yeah. And there are others who do microloans and so forth. Those would be within the hub and other supports.
Of course. Thank you. And one final question. How often are these pathways updated? How frequent is the updates to these pathways as policy changes regarding licensure and eligibility happen frequently?
I can start an answer there. We have a work plan as a team to look at the pathways on a monthly basis. But as we shared briefly today, we really did work smart in terms of creating the infographic approach with hyperlinks embedded in those documents, because we know that information is fluid and changing. So in terms of content to the pathways, the short answer is that updates that may affect the infographic. We have tasked monthly, but it's our hope that the use of those embedded hyperlinks will allow individuals to access information that's changing rapidly. So we would, suggest downloading and accessing the pathways as a just-in-time process when you go onto the platform.
Thank you. And with that, before I jump into the final wrap-up slides, are there any final words of wisdom to share with the audience today?
I guess just for myself, thank you for your interest. It just shows how many people are passionate about improving the access to healthcare. Through internationally educated health professionals, they provide a wealth of experience. They just need the opportunities to connect into the Canadian system. Let us help you orient you to the Canadian system, and they're great additions to the team. They make up to a quarter of the workforce already, but we need to do better. Obviously, we need more of them. So thanks to everybody for attending. Look forward to your feedback on this session. Always happy to improve what we do at N4. So
Thank you. Thank you, everybody. Thank you very much to the N4 team for taking the time today to participate in the discussion and present all this information that is available to you on our website at newcovernavigation.ca. As well, we will also be presenting once more on March 27th. We'll be presenting the French version of this presentation for le Centre de Réseaux Info pour le PSFE. And very much thanks to you, the audience, for joining with us and engaging with us today. You're very welcome to join us for any of our upcoming events as well. And if you missed any part of today's presentation or would like to watch this again, we will be posting the recording within the next week or so to the N4 platform. We want to continue the dialogue that this has started, so we'll be moving all questions that we didn't get a chance to address to our meeting place on the N4 website. And we've invited, of course, all our N4 team to respond to any of the questions that we didn't get a chance to address today. We've also curated several resources alongside what has been presented, and you can find these in our resource toolkit, and we'll link them when we share the on-demand version of this discussion. So once again, if you haven't yet, please sign up to newcovernavigation.ca for all our resources and learning opportunities. Along with that, you will be provided a link to complete a survey to share your feedback with N4. These surveys very much help with improving and seeking out new webinar content and opportunities that are responsive to topics that you're interested in. We kindly ask that you follow the link and complete this brief survey, or you will be directed as well once you have left the webinar. Again, as well, check out our N4 mobile app. It's available on Apple and Android devices through the QR code here by going to newcomernavigation.ca/iOS or /Android. And thank you again. We hope you can join us at a future N4 event, and we hope that you can stay safe and stay well. Take care, everybody.